Welcome to the Pediatric Intraosseous Infusion skill. This skill is designed to test your ability to establish an intraosseous infusion in a pediatric patient just as you would in the field. You will have a maximum of 2 attempts to establish a patent and flowing intraosseous infusion within a 6-minute time limit. Within this time limit, you will be required to properly administer fluid to a pediatric patient just as you would in the field based on a given scenario. Although we are using the mannequin, you should conduct yourself as if this were a real patient. You should assume that your preceptor is the parent of the patient and may ask them any questions you would normally ask in this situation.
For the pediatric IO station, I have to make sure that I have the proper equipment and everything that I need. I have my fluids, a 60-drop set, alcohol preps, tape, some items here to be able to secure the interosseous down. I do have an extension set, some gauze padding, and 10 cc syringe, as well as some 18 gauge needles to be able to draw up the saline for the flush. So before I start with my patient, I'll prepare what I have here on the table. An 18 gauge needle. And I'll draw 5 milliliters of saline for my flush. We'll use an extension set. I'll go ahead and flush the extension set. Have it prepared. I will then get my bag ready for use. Having assured that I have all the equipment and necessary items I need to establish the interosseous for this child, I'm going to inspect my fluids, making sure that I do have the appropriate fluid, that it is within date, and I have no moisture in the bag. Open the bag and make sure I don't have any particulate matter inside of the bag and that the fluid appears to be clear. Remove the port cover. Take my 60-drop set that I will use for my pediatric patient. Running my roller valve closer to the top and making sure that I turn that off. Remove my port cover, my spike cover, spike the bag. Press the drip set chamber until I get it about half full. Then I'll make sure I have all the air drained out of my line. Have all the air out of my line. And now I will secure this in place and have it ready for use. Now that I have everything ready, my IV line is ready to go. My flush is ready to go. For this patient, I've decided to use the Jamshidi interosseous needle. Get my alcohol prep ready. Choose my site, which should be 1 to 2 centimeters below and medial to the tibial tuberosity. I'll clean the site using an aseptic technique. Grasp the leg Hold the needle at a 90-degree angle. Use a twisting motion until I penetrate into the bone marrow cavity. Secure down. This time I'll remove the stylet. Dispose of into the sharps container. Attach my flush. Aspirate back, checking for any bone marrow or blood. I may or may not have that. A lot of the attempts are actually a dry stick. And then I will slowly flush the site. Checking for any infiltration, or any sudden swelling. Once I'm comfortable that the IO is patent, I will secure it. With the tape that I previously tore, and I can leave the syringe attached, or if I'm administering fluids, we'll at that time attach the IV, run our fluids at the desired rate or the desired bolus as instructed by the evaluator. Another interosseous technique that may be available to you is the Easy IO. The Easy IO is an electric drill motor with various sizes of interosseous needles. For our patient, we'll choose the Pediatric. The needle actually secures to the drill motor by magnet. So we have the drill motor and the needle now ready for our use. We'll clean our site, the same site as we have described before, 1 to 2 centimeters below and medial to the tibial tuberosity using the aseptic technique. We'll grasp the leg firmly, place the drill and the needle at a 90-degree angle, and drill until we penetrate into the bone marrow cavity. Once we've reached the proper depth, we'll remove the drill motor, remove the stylet, dispose of over into the sharps container. Attach our flush, aspirate, checking for bone marrow or blood, and then we'll slowly inject the fluid in to the site, observing for infiltration, swelling, or coolness around the site. Once we have identified that we have a patent IO that is free-flowing, we can either leave the syringe attached, secure the line, and possibly attach an IV line and administer the appropriate bolus or drip, whatever the evaluator has instructed you to do.